living in the post-pandemic, post-Roe world, privilege and reproductive freedom. Here's a quick table of contents. Hi, I'm Cindy and I'm a rising junior at Walnut High School in Southern California. I'm also the founder and executive director of Ignite Her, an organization that is dedicated to empowering girls to reclaim their power and take on leadership positions. I began this organization as a way to reconcile with my own past, as a girl who has struggled with double standards in my whole life. As an antisocial younger girl, I was constantly told I was too emotional and shy. But when I got older and became more confident and talkative, I was told that I was too rebellious, aggressive, and bossy. By starting this organization, I was hoping that I could help other girls recognize that they are worthy and valid, no matter what judgment is placed upon them. Within this organization, I've been exposed to much of the work that I've done with reproductive rights. Through this, I have campaigned for reproductive rights through various projects and initiatives, and also helped support policy change to support reproductive rights. Starting this organization, and within this, I've gained a lot of experience working with reproductive freedom and talking to people who have directly been affected by things like the overturning of Roe v. Wade. In addition to this, I also serve as a project director for Youth for Earth, a coalition of 34 different nonprofits from 9 different countries that advocates for international cooperation and environmental literacy. At school, I'm the president of multiple clubs, and I also interned for the District 56 Assembly Office, where I work to honor constituent opinions and represent the state government at different events. In the LA chapter of the United Nations Association, I also help conduct research and campaign to further the UN Sustainable Development Goals. In the future, I hope to work in the intersection between policy, advocacy, and health. I also plan to continue being involved with activism and philanthropy throughout my whole life, specifically in the causes of women's rights, social justice, and environmental protection. Now let's go into the real important topic, the topic at hand. Reproductive rights is not just about healthcare or legal frameworks. It's about autonomy, dignity, and fundamental human rights for women everywhere. Imagine being denied the ability to plan your future, control your body, or make choices about your own well-being. That's exactly what infringements upon reproductive rights does. Reproductive rights encompass a range of freedoms related to reproductive health and decision-making, and empowers women to decide when and whether to have children, which directly impacts their education, career, and economic opportunities. They ensure access to essential opportunities like healthcare services like contraception and safe abortion, crucial for safeguarding women's health and saving lives. Unfortunately, though, in recent years, reproductive rights have come under attack, both nationally and internationally. These attacks and the impact and uncertainty it brings often disproportionately affects certain disadvantaged groups. Let's see what this means by analyzing 2 categories, the national scale with the US and the international scale. The overturning of Roe v. Wade was a devastating blow to reproductive rights in the United States, setting back decades of progress towards gender equality and bodily autonomy. This landmark Supreme Court decision was pivotal to granting women the right to make decisions about their own bodies, including whether to have an abortion. While this was devastating for all women, the law and the overturn of it disproportionately hurts certain women. If overturned, inequality and intersectionality plays into the effects in more ways than one. Overturning Roe v. Wade has allowed states to impose severe restrictions or outright bans on abortion, disproportionately affecting marginalized communities who already face systemic barriers to healthcare. Women in states without access to abortion need to travel to states where it remains legal, necessitating money, time off work, and childcare for the existing children. We're reverted to a situation where women with means can still obtain abortions, while poor women cannot and have to suffer and raise their children when they didn't want to, or get an illegal abortion, which is even more threatening to the life and the safety of both the child and the woman herself. The most affected will be the young woman of color, and the woman living in the Deep South, women who are already systematically disadvantaged. We've seen this again and again. We saw this before Roe v. Wade, and we're going to see it again. It's doing the opposite of what it was intending to do. Let's say you are a low-income person of color and you're a young girl who was raped. You live in a state where abortion is now legal. Let's take a look at what your options are. 1, you can get an illegal abortion, though it might lead you to more severe charges than what your rapist gets. Or 2, you could put your whole life on hold and put your family deep into debt to travel to another state for an abortion. Or 3, you could have the child and deal with sky-high childcare prices as an unprepared teen mother who would have never chosen this for herself. Basically, it's not looking too great. But the bottom line here is that the overturning of Roe v. Wade bans abortion and threatens contraception for those who have been historically hurt the most and right now need it the most. However, while the debate over Roe v. Wade continues, and it is as important as ever to continue talking about it, you see that internationally, the situation is even more dire. Those inequities that we see in the US on a local scale and a state scale are exacerbated to a countrywide scale. We see that while some women in the US may have to travel across states to get an abortion, for many women in developing nations, they might need to travel to another country. In many nations, access to services like contraception, safe abortion, and education are non existent or severely limited. We see that they're curtailed by restrictive laws, cultural taboos, and lack of access to basic healthcare services. Women endure unsafe abortions, maternal and mortality rates are tragically high, and societal norms perpetuate cycles of poverty and gender inequality. This is especially concerning when we look at the struggles that women in developing nations experience, especially sexual violence. Let's look at South Africa as an example of a case study. 40% of South African women are raped in their lifetime, and 19.2% of South African girls and women have had an adolescent pregnancy. These stats are far higher than they are in developed nations like the United States, and we see that there is a greater need and even more of a lack of access in South Africa. In conclusion, we see that the world of a ban of abortions versus a world without access of anything, contraceptives, birth control, and childcare, is the world that we're looking at. We're seeing that a ban of abortions is happening in the US in certain states, yes, but in the wider world, we see that there are countries without access to anything. So yes, the fight in the United States is crucial, it's so important. But when we zoom out, we realize we also need to recognize the rising need that we have in other countries. In countries like South Africa, where women lack even the most basic reproductive rights, it's a matter of life or death. It's about recognizing that every single woman, regardless of geography or social economic status, deserves the right to decide if, when, and how many children to have. It's about challenging oppressive systems and advocating for comprehensive healthcare, education, and legal reforms that empower women to lead healthy, fulfilling lives on their own terms. Ultimately, protecting reproductive rights isn't just a policy issue, isn't just a healthcare issue. It's a moral imperative. It's about standing up for the rights of women everywhere to control their bodies and their futures. It's about ensuring that no woman or young girl is forced into motherhood against her will or suffers the consequences of unsafe procedures due to lack of access. By fighting for reproductive justice, we are fighting for human rights, equality, and the dignity of every person to live with autonomy and respect. And we see that bans and accessibility of reproductive rights, no matter where, will always ultimately hurt the people who are already disadvantaged the most, while not saving lives, but rather endangering them. My references are on this page.